I am Santiago Garfias, a neurosurgeon. Now I bring you another case in which a patient with a history of migraines and poor analgesic control, after a traffic accident, presents with cervicalgia. Imaging tests revealed a cervical disc herniation for which she underwent surgery. 1 year later, she continued to experience cervical pain and underwent a second operation for cervical canal stenosis. Despite this, after an initial improvement, the patient experienced progressively worsening symptoms, including increased cervical pain and headaches, as well as lumbar pain and paresthesia in her extremity. This made her unable to perform her previous job, preventing her from working as a waitress, leading to depression and anxiety. The patient has undergone physiotherapy treatment without showing any improvement. She reports constant paresthesia in her hands and feet and a poor tolerance for painkillers, forcing her to spend most of her time resting. During the assessment, she states that anxiety and pain make it difficult for her to fall asleep, leaving her constantly exhausted. As a result, she has a diminished quality of life, and her social life is restricted. Furthermore, she has developed an allergic reaction to painkillers, which limits her management options. It has been explained to her that her case exhibits characteristics of central sensitization due to generalized pain and multiple chemical sensitivity. Therefore, neuromodulation treatment is offered, which, by stimulating the parasympathetic system, can improve her chronic pain, as well as potentially benefit her sleep quality and fatigue. The patient agreed to the treatment, signed the consent, and attended the initial assessment and registration in the WICardio system. She presents with adequate heart rate variability but an elevated parasympathetic tone. An initial treatment program of 10 sessions over 1 month is established. The first 2 sessions were conducted with the central C7 electrode and programs 1 and 7 to encourage autonomic adaptation. After the first session, the patient reported significant improvement in pain and sleep but experienced spasms in her toes, which are painful, along with lumbar pain. Treatment commenced with programs 3 and 6, adding the 7th at the 5th session. She reported a substantial improvement in sleep and pain, but the fatigue persisted. Treatment was supplemented with program 5, which partially improved the exhaustion. However, due to stress during psychological treatment, the headaches and pain intensified. It was decided to add program 5 with the Nesian electrode while maintaining the central nervous system treatment with programs 1, 6, and 7. She reported pain improvement and a global improvement with the disappearance of spasms in the extremities. Unfortunately, the patient had to interrupt the treatment for some time because she was unable to travel. During this period, her radicular symptoms and constant headaches intensified. Finally, after 6 months, she resumed treatment with programs 1 and 7. With the time elapsed since the last session, she also added program 6 for pain, program 5 for fatigue, and program 9 for headaches. Currently, the patient continues sessions with better symptom control, noting the need to resume sessions due to the observed effects. As in this case, it is necessary to evaluate those patients who require maintenance sessions for symptom control, especially when the chronic nature of the symptoms indicates a delayed response to treatment. Often, upon resuming sessions, patients exhibit quicker improvements, so they must be encouraged to continue treatment and assess the effects observed during the treatment course. In this case, we can see how patients can improve even if they have become discouraged with conventional treatments. Above all, we must motivate them to continue with the treatment and to recognize the benefits they have experienced throughout the treatment. Thank you.